This is Selma Schimmel, and you are looking live at the great city of Chicago, which is once again playing host to the American Society of Clinical Oncology, ASCO. This is ASCO's 49th annual meeting, and this year's theme could not be more appropriate: Building Bridges to Conquer Cancer. More than 30,000 of the world's foremost cancer specialists are here, and so is the Group Room, making our 15th appearance at ASCO and one of our very best. Joining me now is Dr. Stefan Glück, professor in the Department of Medicine, Division of Hematology Oncology at the Sylvester Comprehensive Cancer Center, University of Miami, Leonard M. Miller School of Medicine. Hello, Dr. Glück.
Hi, thank you very much, Selma, to having me again.
There's a study regarding therapeutic combinations for HER2 positive breast cancer not increasing cardiac issues. And let's talk about that a little bit.
Well, this morning there were two posters in a discussion session that dealt with the issue. One is from Germany and one is from the United States. And what they have looked at, one study, 8 years follow-up in the adjuvant early breast cancer setting, whether cardiac events increase over time. It's not the case. They remain below 1%. So initially, there may be a combination of events up to 4% if combined with anthracyclines. That's why we usually do it sequentially, not together. But in the long run, actually, the cardiotoxicity does not increase. So it's 8 years later, still safe. And the other one is from Germany or from Europe, showing similar data. It is very safe, and we do not see any late side effects at this point.
Before patients take Herceptin, though, they still have to have a baseline cardiac screening?
Correct. So this is not real-world data. These are clinical studies data. Mm-hmm. And it remains to be seen whether in the day-to-day use, patients outside of studies will tolerate it equally well.
But also in the research setting, it is not uncommon where, as we talked about, ultimate application for earlier stage breast cancer, but in research, things often begin in a later stage
Correct.
setting.
Yes.
Before they begin to have
Yes.
more research and gain approval for broader application.
Yes, and that's exactly the steps we are taking now. So the studies in earlier stages, first-line metastatic, are finished, but not reported yet. So data will come out soon, we hope in San Antonio, so 6 months from now or maybe next year. And studies using TDM1 in the neoadjuvant and adjuvant setting, meaning early breast cancer, not stage 4, are underway.
You know what's so remarkable is that in one moment when a patient can find out or does find out that they have this overexpression of this HER2 amplification, and it hits with such a bad feeling and so much fear for patients, but yet at the same time these patients are so lucky. Yes. Because we have something so personalized. Yes. To treat their cancer. This just builds on that, in some way, fortune for an unfortunate situation.
Yes, indeed, that's very true. And actually, some colleagues of mine and myself, we published a manuscript just a year ago calling the HER2 positive disease bad disease. It's a double-edged sword. It's bad per biology, but now much better than they used to be because they have so many compounds to fight it.
Thank you, Dr. Stefan Glück, Sylvester, Distinguished Professor, Department of Medicine, the Division of Hematology Oncology, the Sylvester Comprehensive Cancer Center, University of Miami, Leonard M. Miller School of Medicine.
Thank you.